I'm here with dentist Dr. Longbow, and we're talking about his groundbreaking 2x4 early prevention dental health program. And I think we've come to the fourth one of these two. So why do I need to take my baby to the dentist 2 years old? We already had the second trimester, 2 months, 2 teeth, now 2 years old. Why take the child then?
At that time is when the molars are coming out. So dealing with 2 teeth is pretty straightforward. They're right in front.
We see them easily.
Yeah, no problem. Now the back teeth come in, and then it's like, wow, what do I do, right? It's all the way in the back, and that's when baby can bite. And some kids are still not cooperating, right? So between the 2 teeth to 2 years, it's a long time. And if we are consistent, by that time, if we can succeed to instill that good habit, then it's smooth. But if it hasn't been done, it's another chance for the dentist to help mommy succeed. And that's the goal, because everybody's different. And for one child, it could only take about a week before they get used to it. Other children, they just won't have it, and the parents may give up halfway. But if we see them at 2 years old, and then we see that if there's any small issues, then we can say, well, are you brushing the teeth? And if you are, good. If not, then we can help. What is it that is so difficult, right? And then we will help you overcome that barrier, and that way we can make sure that the babies are healthy. And at that stage, because of the molars are in, we're starting to get teeth contacting other teeth, and there's more chance of bacteria. And
food being caught in there. So you've made it real easy here with this 2x4 early prevention dental health program. This would be the fourth one of those. This would be the second trimester, 2 months, 2 teeth, and now 2 years.
So, Dr. Julie, we've arrived at 2 years. Are they the terrible twos when it comes to dentistry as well, or not so much?
With kids, it's always a terrible something. It's a terrible 2, terrible 3, a terrible 4. But at 2, chances are the kids hasn't had any major dental problems yet, and we can also make their first visit a happy one. If the child is proper enough, we can even perform a first cleaning to them, so that a visit to the dentist is not something to fear. It's not scary.
It's not painful.
It's just something normal.
Right.
And that's the purpose of the second year visit as well. Is that we want to project to them that dentistry is okay. They don't need to fear anything. And if we can make oral hygiene a good habit, hopefully they will never have to fear it either.
Right.
So the 2 years is very important. And also, if there's any problem that may have started, if they have any cavities that have started, we can catch them early on. So also treatment of those cavities can be easier.
Sure, because catching it early is a less invasive procedure, I guess, than if it becomes advanced and they wait till the child is 3 or 4.
That's the whole purpose of all this prevention. If you treat a cavity small enough, we more than likely we will not require to give them any freezing as well. So again, make it as pain-free as possible to the child. And if they're not cooperative, then we'll work with them. But again, at that age, it's important that we meet with them. That we
build the relationship, right? Yeah. So it's not critical that you intervene with there, but just bringing them in anyway, you're having a chance to interact with them and make them comfortable.
Yes. But if mommy has been successful in brushing the teeth and taking care of baby's teeth, chances are the kid may be very receptive of receiving treatment, because they've been used to having someone look at the teeth or work on the teeth or brush the teeth. So their first visit is just something very simple, and it could be fun as well.